Stockouts are going to be common problems across the board, whether you're working in Ministry of Health facilities or CHA facilities. Therefore, special attention really needs to be paid before the project begins to address some of these issues. And it's important to begin that advocacy and to lay that groundwork with all the stakeholders early on. And then finally, introducing cycle beads, which for those of you who don't know what they are, this is what they are, and can talk afterwards if you want to know more information. But cycle beads really helps to renew interest in family planning in the project areas and brought a lot of communities who have strict religious convictions, like in Islam and Catholicism, able to bring them on board to begin using family planning when they had not been using it before. And we also heard a lot of positive comments that women, because we worked in a very mountainous region right around Mount Kenya, they appreciated the ease of attaining cycle beads, that it did not have an expiration date and that you didn't need resupplies. And so we found that it really brought new users to family planning who were not otherwise using family planning before. And that's all I have. So does anyone have any questions? Sure.
So we can take a couple of questions for clarification, if you would, and we're going to save some time at the end also for broader discussion. Henry?
First, really an excellent presentation. Are you beginning to consider injections being provided by the community health workers?
I see that, I think, would be a great thing to add. There is a pretty robust training component that has to go along with that in order for injectables to be provided at the community level. And unfortunately, the funding from World Bank was incredibly small and only lasted a year. So the project actually ended a week ago. So that's not in our plan, but I do agree that that would be a great next step.
And I believe also that it's not yet in the Ministry of Health guidelines.
Right, it's only been field tested, yeah.
So Christian health associations have been a little reluctant to sort of take on things that aren't approved by the Ministry of Health since they work so closely together. Another? Yes. Could you introduce yourself?
Okay, my name is Bauchi McKinney, and I am a student at Loma Linda University. My question is that, I know your project focused on getting family planning to women in developing countries. So what is your program doing to recruit the men? Because especially in African country, the men are very dominant in determining how many children the women can have. So how are you guys recruiting the men into this project in order for the women to be comfortable to reach out to you guys?
That's a really good question. I would say that we had a lot of success and that using the community-based strategy is essential to getting men on board because, as most of you know, men usually don't accompany women to the facility when they go for their family planning counseling visits. And so to have community health workers who are both men and women out, and they're the peers and they're known by their other community members, to have them out disseminating these messages, engaging men and women in discussions about family planning has really helped bring men on board and be able to discuss it in a way that is sort of free from those power barriers between the provider and the client. And also engaging the religious leaders has really helped because I'm sure you also know most religious leaders are men, and to be able to give them that correct information that they can then disseminate to their congregations is essential.
And while Lauren is shot. Okay. While Lauren is shy about it, the cycle bead is also a method that really promotes discussion among men and women. So when that's also a tool, that works well. Did I just not push the button? So, did you have a question up here? Okay. Maybe. Do we have time for one more? Yes. Okay. So somebody, an enthusiastic hand, and we'll come back to you during the discussion.
Thanks, Laura. Awesome presentation. Excellent work. We've been working here in Shigoria around the mountain from us. We've been on the other side of Mount Kenya for 28 years and doing very similar things. I love the way that the cooperation and the collaboration of this particular project and really well put together. Also love these beads. That I really think we're onto something with that. I'm currently working some in Haiti as well with this, and so just want to appreciate this effort. This is excellent, and good presentation as well.
Thank you. We should talk after because I'm also working in Haiti as well.
Okay, great. Well, let us move on and save your other questions for the discussion period after. Amy Metzger is the project director for CCIH's technical grants, and she wears a lot of hats and covers a lot of bases. And as she's pulling up her PowerPoint, I'll turn it over to her. But actually, as Lauren was saying, this no product, no program, we actually didn't discover that. It had been learned before, and so we decided to check with some other people who've been working on that and other things. So, Amy?
Thank you so much, Douglas. I think I better not stand too close. Thank you, Lauren. That was a great presentation. I think you laid a good foundation for what I'll be talking about. So I'm just going to be giving an overview of what CCIH is up to. A lot of you probably don't know what we've been doing in the last year or so this is a broad overview, and we can have more time for specific questions as we go if we have time later. But for those of you that don't know entirely what Christian Connections for International Health is about, we're a forum that, we're a Christian organization, obviously, that is promoting health from a Christian perspective, and we're providing a forum for dialogue, networking, advocacy, and fellowship as we do today and through other venues. So we're glad for so many of you that are here that have never been here before, and we hope that you find this a great way to be interacting with others. We want you to interact with us, with those of us on staff, so that we can help to you in what you do, but also take the opportunity to learn from others around you as they may be doing similar work in the field. This is a picture from last year at our Buckystown venue. This is just an overview, and I'll get into more detail of the things that I'm involved in, and I probably can guess that most of you haven't heard of some of these things, so it'll be good to give you a little bit more detail about that. And you may wonder why family planning. I don't know if I even need to go over this, if we need to be convinced about why we should be doing family planning, or maybe even why CCIH is doing it. But I think Douglas mentioned this in the pre-conference. Really, the family planning ties into all the Millennium Development Goals, especially these three that are listed, as far as reducing under 5 mortality rate, reducing maternal mortality rate, and also getting universal access to reproductive health. And I really feel, I think a lot of us feel that the Christian organizations are uniquely poised to be able to provide family planning services. These are 2 little statements from Inpatient Optimist, which is a blog that Bill and Melinda Gates put out, and one of our board members, who I don't think is in the room right now, David Olson, wrote this blog, which got a lot of hits on Facebook, I noticed, and got a lot of good publicity for CCIH. His first statement out of the blog is, "The truth is that FBOs have been providing health care and even family planning for decades. They provide anywhere from 30 to 70% of all health care services in many African countries. And this is especially true in rural and remote areas where the government services don't always reach." So that's really, I mean, these networks are so infiltrated into the countries, and we have to take advantage of that. We can get to places that the government can't, so it's a unique opportunity we have to get to these unreached areas. And I like this quote from Henry Mosley, who's in the room, Dr. Henry Mosley, who's at Johns Hopkins University. He says, "The secular community can provide technology and services, but the religious community can get to the values behind who's making the decisions, the power relationships in the family, and the dignity of women." So if you'd like to read that blog, it's, I think, on our Facebook. I know it's easily accessible there, I'm pretty sure, so you can get to it and read the whole thing and learn more about what CCIH is up to, and I think it mentions a couple of other organizations. Just briefly, these are pictures, actually, I wrote a blog myself, and I included these pictures in there. This is taken almost 10 years ago in rural Uganda, and I think many of us have encountered these situations where you see babies born in very sparse conditions. I was helping to deliver these babies, and it's the first time I'd ever done that, and I thought maybe I'd become a midwife, but after all the blood and a room that wasn't well ventilated and not a lot of water, I was like, probably not in this setting. But luckily, these babies were born, and I think pretty healthy from what I could tell, but I really haven't followed up with them. I don't know what's going on with them almost 10 years later, but it's just amazing that in such a rural part of Uganda, near Lake Albert, that these babies were actually born relatively safely, considering how if you saw the conditions under which these babies were born, it was pretty remarkable. But I very little access back then, and probably even still now, to family planning services. I'm in touch with a health worker still that works out there, and he's really struggling with getting access still 10 years later. This has been going on. So we definitely need to do more to help so that women can deliver healthy babies and also be able to space their children well. This is just a short little video. I won't make it too long, but if those of you haven't seen it, it's a nice little video from that was put out by the Reproductive Health Supplies Coalition that I'll be talking about a little bit later. It's called Empty-Handed, and it's just about contraceptive security and getting the supplies out there. And it sounds like maybe the volume's not working.
Oh, there's no reason it shouldn't be working. Oh, darn.
Should we just play it with no,
Yeah.
maybe? Maybe I should, I think I'll just go ahead and play it because I'm not gonna assume we're gonna get it fixed. Sorry about that. This is a very short one. It's in English, French, and Spanish, I believe, and there's longer versions. There's like an 8-minute. This is like a 1.5 minutes.
baali badde balina obulamu bungi ate n'abaana baali badde kwegamba baali badde basobola okuvaayo ne beekubira omulanga
I know we all see statistics so often, but I think we just don't really sometimes absorb what those numbers really mean. And, you know, 215 million women want access and don't have it, and 53 million have had unintended pregnancies because of that. It's really pretty staggering if you think about it, that what's going on around the world. So I think we need to really take that to heart and figure out, you know, what we all can do. I probably don't want to get into the discussion about who's doing family planning and why not and all that, although we could at some level. But I think we just need to learn more about family planning, take advantage of the opportunities to work with us so we can help educate you and educate your members about how to get more involved with it. But I'll go ahead and talk about some of the activities we have going on. Lauren has talked in detail about their work at the Institute for Reproductive Health, and we've been working with them for a few years. We'll hopefully be working with them maybe through the end of the year at least on this grant. And these are some of the objectives of this grant. We're providing support to the members on integrating family planning into existing health programs, including the fertility awareness methods that she's talked about. We're participating in the Reproductive Health Supplies Coalition, which I'll talk about more, to strengthen the reproductive health supply chains to the faith-based organizations that we're working with. And we're also mobilizing resources to strengthen the capacity of facility-based and community health workers from the Christian Health Associations networks to offer family planning services, including FAM. So that's one of the activities, one of our grants, and I won't get into too much detail on that right now.